Wait, sorry. Hello everyone. Welcome to Third Spacing, the podcast where we explore important issues on the peripheries of clinical medicine here in Singapore. This is your host, Brian. Today we have with us Dr. Tsoi Wing Foo, who has an experience of over 60 years in the field of psychiatry. He used to practice at Tsoi Clinic in Orchard, Singapore. Dr. Tsoi developed an interest in transgender psychiatry in the 1970s and became one of the pioneers in the local psychiatry scene, dedicated to the needs of transgender people. So now, good afternoon, Dr. Tsoi. Thank you for being here with us today. As one of the pioneers in the establishment of the care of transgender patients in Singapore, he also wrote a book called Cries from Within, which discusses the obstacles faced by transgenders in Singapore and the treatment options available for them. What inspired you to dedicate your life's work to transgender people and this field of psychiatry in particular?
I treat transgender because most doctors do not know how to treat them, and they have nowhere to, they don't know which doctor to go to. I did psychiatry because when I was a medical student, there was very little teaching in psychiatry. So I took it up because out of mainly curiosity, find out what's going on, because in those days, psychiatry was based on Freud's theory, sexual theory, and just want to find out more about this sexual theory. Now we don't bother much about Freud's theory. We treat mental illness as organic disorder or biological disorder.
Okay. So, regarding like gender dysphoria and transgender health, there's a lot of stereotypes and misconceptions in regular media surrounding these topics. Can you help us define what gender dysphoria is and what it means to have gender dysphoria?
Gender dysphoria means a person feels very uncomfortable with the gender. It started very early, and they will try to behave like a member of opposite gender. As they grow older, they feel more uncomfortable and will seek treatment. They started usually at say 8 or 9 for female transgender. They look at male partner usually when in primary school, and they get married to the partner after they've undergone the gender change surgery. They need to change the gender from female to male because Singapore do not allow same-sex marriage.
Yeah, so like the care of these patients, right, has always been happening under this backdrop of very intense scrutiny by Singapore as well. So in spite of that, you managed to really support a lot of these transgender patients over the course of your career. Can you tell us a little bit more about how your experience was like looking after these patients back in the 1970s and 80s?
This transgender, they're very distressed by the gender, and they will continue to seek treatment. They're very dependent on their opposite sex hormone. They will look for any doctor who provide them with such hormone. Some of them may buy hormone from the internet, and they're very concerned that when they retire, where could they get the hormone?
As you have mentioned just now, how the different hospitals have stopped the gender care services, and what are your thoughts regarding this disparity in the approach and the changes in their attitudes towards transgender patients?
And the main person who pioneered the service is Professor Ratnam, Professor of Obstetrics and Gynecology. But after Professor Ratnam have retired, the hospital stopped treating transgender, so they have to seek treatment from other places. And since not many doctors treat transgender at that time, they came to see me.
So I think over the years you have done a lot of research as well as written a lot of books. And Other than these avenues, what are some of the other ways that you try to educate the healthcare community on the care of transgender patients?
The healthcare community are not interested in treating transgender, and I'm not able to convince them that they need treatment. I sometimes ask doctors in our hospital to set up a transgender clinic. Up to now, there's no such clinic. In fact, there's no feedback. I didn't find out why they did not want to set up such clinic.
Is there like a specific learning point from your career that you hope the future generations of doctors and psychiatrists would take with them as they take care of transgender patients in the future? Like, what's the one main thing that you think is most important in their care?
I think main care is that this patient initially, we try to stop them from changing the gender through psychological treatment. In the United States, after 50 years of psychological treatment, they found they didn't work. So right now, they stop psychological treatment. The main psychological treatment is to help them to adapt to the new gender. The main treatment is, as I mentioned before, hormonal therapy and gender change surgery. The first patient is a male who wants to change to a female. He came dressed as a female and tell me that he has been this feeling for a long time and feels very uncomfortable. He has been going to many doctors for treatment but was rejected. Then she found out Professor Ratnam starting to do the gender change surgery, and Professor Ratnam wants her to come and see me to certify that he is suitable for surgery. In those days, we did a very thorough examination. Apart from finding out, taking a history of their gender development, we also do an intellectual test for them, a personality test, and an interest profile. What are the interests? What things they like to do? What work like to do? So after doing all the tests, we see them several times to make sure that they are transgender. Because in those days, we are very new to this condition and very concerned that they may find the operation is not suitable. They want to reverse the operation. After many interviews, we write a report to Professor Ratnam to complete the operation. And after that, Professor Ratnam will continue to treat them. We may call them up to find how they're doing. And for all cases who had operation, all of them are very satisfied with the operation.
When you're practicing as a psychiatrist, right, treating patients with gender dysphoria, you mentioned that the medical community is not very open to the idea of taking care of transgender patients and learning more about transgender health. What do you think was the response like from the medical community and LGBT community during that time, and how has it changed?
The average person thinks that a male should not become a female, and they continue to have this idea. And since then, there is not much change in the attitude.
So, just now you mentioned that there's not much change in the perspective of society towards transgender patients, and there's some resistance by the medical community. Yeah, how do you do with this sort of resistance and this obstacle when you're treating your gender dysphoria patients?
And we can't do very much as a doctor. You have to wait for some important person who has a child, then this person may start to bring this up and popularize this condition. Because the average person thinks that this condition is chosen by the patient.
Dr. Tsoi, we are actually very interested in this sort of concept of updating the way terminologies is used in the medical community. Back in the 1970s and 80s, when you're taking care of transgender patients, they used to be called transsexuals, but that term has since been gone out of favor, and now we use the term transgender instead. So what are your thoughts on this sort of updating and the use of different terminologies? Is it important, or is it something that is not that significant?
Initially, male dressed as female are called transvestite, and this male dressing as female has been going on for a long time. And until 1953, some of them want to change the gender from male to female. And because they want to change gender, they're called transsexuals. The authority thinks that it is a sexual disorder. By the late 90s, the psychiatrists felt that this condition is nothing to do with the sex. It's something to do with gender identity. So they called it gender identity disorder. And later, they found that this is not the identity, is a discomfort with the gender. So they call it gender dysphoria. So now the term is changed to gender dysphoria.
I think you can really see the changes in the attitudes and perspectives towards transgender through the evolution of the terms that have been used to sort of classify this disorder. Yeah.
Yes, it is true. Because in the early days, the male to female transgender were male prostitutes and give the impression they were bad people. But times go by, they become educated, they're less dependent, they're more independent, and they can live a living by doing better work.
And do you find that because of this sort of word of mouth community approach to seeking help with patients with gender dysphoria, they come to your clinic knowing a little bit more about their disorder and sort of having a better idea of what treatment options are available for them? And do you find that they have a sort of a treatment in mind already, or do they just come just trying to seek help?
Yes, many of them, they know how to treat. They know that they need hormone. And some of them will tell me what hormone they require. They're more knowledgeable because of the search engine.
Yeah, and I think like the management and the approach to gender dysphoria has certainly evolved since it was first talked about so many years ago in Singapore. Yeah, and as we gain a better understanding of what it means to be transgender and the different needs of their care, the approach to their care would definitely evolve, further down the road as well. Yeah, but what do you think, in your opinion, is the next main focal point in this journey towards better healthcare for transgender patients?
You need to treat them as an illness of some sort, a gender illness. Like all other illnesses, they need treatment, and they need the right treatment, which is hormone therapy and gender change surgery.
So, Dr. Tsoi, at this point, we'd like to ask you that, so sometimes some people find that in order to pursue a field of this nature, you sort of have to be personally involved in that particular group. So in this case, that would be gender dysphoria. What is your perspective on this point? Most
people do not bother about them, except those who are close to them. the parents, the relative. Generally, from male to female, the mothers are more concerned. And sometimes the mother they support them and bring them to see me. For female to male, usually the father is more concerned. There's a father who came to see me and tell me what hormone to give the patient. And some parents are very supportive. They will pay for patient's treatment. Some are very rejecting, especially those males who want to be female. Because of such rejection, one patient told me that they have to wait for the parents to pass away. Another patient said that when she's able, he will migrate to another country.
And I believe treating patients with gender dysphoria is something that is quite sensitive, given that it has to do with their gender identity and all. And I feel like it must have taken them a lot of strength and courage to even go and seek help to get it treated. So why do you think they came to you? What was the thing that made them trust you to share with you all these very personal stories that you have shared?
They tell me this long story because they hope that by listening to or reading the life history, I will give them the proper treatment. But probably then to many doctors who reject them.
So we'd like to ask you if you have any advice and suggestions for those who would like to pursue a path taking care of transgender patients in the future, as well as do you have anything to say to other patients out there who might feel like they have gender dysphoria but do not know what to do at this point in time?
I have to tell patients to change their attitude towards transgender, that this is not chosen by the patient to be transgender. It is a condition where they feel very uncomfortable, and if you treat them, they're very grateful that you are able to help them.
Anyways, thank you so much, Dr. Tsoi, for being here with us today.
And thank you for letting me participate in this podcast.
You're welcome. Thank you so much for sharing with us all these stories as well.
Right.